Today we're going to perform an enzyme hydropeel on Jess, and the Synergie enzyme hydropeel is a really effective introduction to creating a much brighter and more even textured skin. It can be performed as a first time peel, and it's also a great peel to use if your client wants something on demand. They don't have to be prepped for it, although ideally we should be prepped, but they can come straight in and say, I want a peel, and they can have an enzyme hydropeel. The hydropeel contains papain, which is an enzyme derived from pure papaya, and that helps to, apart from decongest epidermal skin cells, it also hydrates the skin. In addition to the papaya extract, we have 15% lactic acid, and this obviously will decongest surface adhered skin. It's actually a glue dissolver for the keratinocytes, and it can be fabulous for any Fitzpatrick skin. So it's a peel that can be used on any skin type. So basically the enzyme peel decongests the epidermis. It stimulates production of new skin cells at the basal layer, and that increases the rate of cell turnover. It also increases the natural moisture factor of the skin, resulting in a more hydrated skin. And it reduces inflammation associated with irritated or congested skin. So what type of skin is best for an enzyme hydropeel? Let's use it on dull, lifeless skin in need of gentle exfoliation. We can also use it on sensitive skin, and we can use it on any Fitzpatrick from Fitzpatrick 1 right up to Fitzpatrick 6. You can also use it on sun-damaged skin, hyperpigmented skin, acneic skin, or aging skin. Now, it's always beneficial to treat the skin with vitamin A, B and C at least 2 weeks prior, but the hydropeel is suitable to be used on skins without necessarily pre-treating. We do recommend one treatment at least every 14 days, and as always 4 to 6 treatments of a peel is recommended. So to start off with looking at your protocol, you'll need the hydropeel solution, you'll need cleanser, you'll need a degreaser, the prepare, obviously a glass bowl, you'll need gauze, or you can use a fan brush, obviously your surgical gloves, and always have a bottle of sodium bicarb at the handy, and that's a neutralizing solution, and it's 2 tablespoons of sodium bicarb in 500 mils of water, and do replace that after 7 days because it can break down. It won't be as effective. So the protocol, firstly, we will explain the procedure to the client and gain a consent. This is a very, very important part of all Synergie procedures. Always have your consent form ready, and Synergie does supply a peel consent if you should need one. Okay, so we're going to start using Synergie Ultra Cleanse. First of all, we emulsify the Ultra Cleanse with water, and then we apply directly to the face. Often it's better to use your hands, your gloved hands, because you do get a lot better coverage over the skin. Now we do like to use 2 gauze, and we fold them quite thoroughly into small squares, and that gets a really thorough cleanse. We prefer to use the fine gauze, the coarse gauze, not the fine gauze, because it is a little bit more abrasive on the skin. So we wash with water, and we put this gauze into our small squares, and we begin cleansing. Now we start cleansing on the jawline, and that's the client's area of concern, and we then move in small circles. Now it's important to be quite firm at this point because we want to use small circles to be firm on the skin, and as you can see, we're working around the skin. And we also work around the nose, and that helps to remove the blackheads, which is often an area of concern, and obviously using gauze gives a better cleanse. And you can actually see the amount of makeup that comes off Jess's skin, and that's just with one cleanse. It's quite significant. Then we actually use Fibrella or daily towels to actually remove the final amount of cleanser. Now often we may repeat, we may do 2 cleanses, we may even do 3 cleanses depending on the client's needs. Now we can see how effective the cleansing is. We're actually going to commence a second cleanse now. So we're going to do 2 pumps of cleanser, of Synergie Ultra Cleanse plus your water. And we're actually going to use our fingers to apply that to the face. Now, you can use gauze to apply the cleanser to the face, but often it's better to actually use gloved fingers because you can feel the area of congestion on the face, and you can really feel where the areas are that need addressing. So it's optional to use gauze or gloved fingers. So we're applying the cleanser on the face. And then we're going to do the second cleanse with 2 pieces of gauze. And we're going to take our gauze, fold it into small squares, squeeze out the excess water, and the face is emulsified with cleanser, and we're really going to use our small circular actions to draw out the impurities and actually remove areas of congestion. Now, this is actually like a mild exfoliation. We're actually going to increase the penetration of the peel, because if we're getting off the layers of dead skin, we're actually going to get a better result. Now, you will notice that the client's skin will appear brighter and her circulation will be improved. You'll get increased erythema, and that will again aid the uptake of the peel. Now, if you are still picking up makeup and grime at this stage, then you can perform a third cleanse. Generally 2 are sufficient, but you need to make sure that your gauze is clean, or else you will have to do a third cleanse.
So last line again.
We do need to make sure that the gauze is clean, or else you will have to perform a third cleanse. Now, we know that oil will impede the penetration of our peel, so one of the main reasons peels fail is because of oil on the surface of the skin. So educate the clients to know the importance of cleansing, and also make sure that you cleanse your client's face properly prior to your peel. And that's our cleanse. Now for the degreasing step. This is a very important part of the step. We're going to be using Synergie Skin Prepare. This may sting a little because the patient's just had a thorough cleanse and there's a little bit of grain-based alcohol. So we're going to begin on our gauze, firm strokes along the jaw, along the cheeks, and up the nose, across the forehead, again down the sides of the face, and we finish under the jaw. How's that feeling, Jess?
Good.
Any stinging?
No.
Okay. Now we wait till any erythema or stinging subsides, and then we apply our peel solution. Now the skin is nice and stimulated from our cleanse and our degrease, and we are ready to apply the enzyme peel solution. So here is our Hydropeel. We are going to use 1 capful of peel, and that's 1 capful equals 1 full pass of solution. We pour that into a shallow dish and we measure 1 capful. We take our gauze, and often a full piece of gauze will do both sides of the face, so it's best to cut the gauze in half, and then each half is going to do each half of the face. So we've now got the gauze, and we're going to apply the peel solution to our cut gauze. Now the peel will not be dripping from the gauze because we obviously don't want any dripping into the client's face, so just damp enough to have sufficient on the face. We also may be able to apply some occlusiderm around the lips and some eye pads on the eyes if you're concerned about the patient or the client getting peel into their eyes. Now we're going to apply the peel, and we begin with the area of most concern because that's where most of the peel will be left. So we start with the most congested area and we work our way up to the least congested area. So start at the chin, and we use firm, definite strokes along the skin, and remembering not to overlap, because overlapping a peel is considered a double pass. So do not overlap areas, and make sure you're firm and cover the skin evenly, starting from the inside of the face and working to the outside. Now you'll work out your own method, but just make sure that you cover each area of the face once only. And as you work up, obviously there's less product. How's that feeling, Jess?
Just a little steam, but it's comfortable.
Now, on a scale of 1 to 10, 10 being the most uncomfortable, how is the peel feeling on your face?
Just 3.
So can you explain how it feels? Do you feel pins and needles or do you feel heat?
Pins and needles.
Okay, our client Jess is doing really well now. The skin is actually the best indication of how the peel is responding to the client. So we've got to look for any areas of concern, any hot spots, any spots that are unnaturally red. But the enzyme peel is a very simple peel to do. Because it's got lactic acid in it, as we know, lactic acid is self-neutralizing, unlike glycolic. So we allow it to neutralize itself. So wait until the skin feels comfortable and wait till the redness subsides. How do you feel now, Jess?
Yeah, fun. Sting's gone.
Any sensation at all, Jess?
No, not anymore.
Okay, so the peel has now self-neutralized, and that is the end of the actual peel protocol. But then we're looking at the aftercare. So we're going to apply Synergie ICU gel, which is a powerful anti-inflammatory. And if the client is exhibiting redness, this is an ideal calming gel to put on the skin. It also removes any heat and brings down any inflammation. So we're going to gently apply that to the client's skin if needed. And that'll calm the skin down. And then after that, we're going to apply Zinc, because we never let a client leave the premises without applying our sunblock. And the sunblock can either be in the form of Synergie loose minerals, which contains approximately 50% zinc oxide and titanium dioxide, or our Zinc, which contains 21% non-nanophased zinc oxide. So zinc oxide is a physical sunblock, so we're just going to pat that gently onto the client's skin. We're not going to rub it in because there is a little bit of redness after the treatment, and that's our physical block. So the client will always leave the premises with sun protection, particularly after a treatment or a peel. Now, interestingly, if the skin does exhibit an erythemic response, and this is very unusual with the Enzyme Hydropeel, but we always must have a neutralizing solution handy, and that is 2 tablespoons of sodium bicarb in 250 ml of water. You change that every week because it does actually become deactivated. So fresh sodium bicarb and water, and we literally spray that on the client's face if they're exhibiting heat or a severe response. Now that will immediately neutralize the peel. Warn the client that they will feel heat, a flash of heat. That is quite normal. The aftercare, we do recommend that you don't apply your high-level active ingredients such as your vitamin A and your vitamin C for at least 24 hours after a peel, possibly 48. And then you can resume your normal skincare regime as soon as all signs of inflammation have settled and you're ready to go back to your normal skin ABC skincare routine. So now the skin is gently exfoliated, greatly hydrated, and we do recommend 4 to 6 enzyme peel treatments, and you may have these at weekly or fortnightly intervals. Thank you very much.